The Multifidi muscles are part of our spinal erector group. They are the deepest and they have the greatest impact on helping to support and rotate individual vertebra. As you can see by this illustration superimposed here, the multifidi can cause very localized, very circular, very spot-specific pain right near or at the segment at which they attach and live, basically. The multifidi muscles can really restrict and cause extreme pain when rotating the spine, reaching across the body or reaching up and down. So to treat the multifidi in this particular video, I'm going to give you an advanced technique which would have the upper back on the rotated stretch. So again, we always use the body support system, but what I've done for this particular segment is I've scooched it down. I'm going to take out the face cradle so that my client is able to scooch forward, bring this arm in and around at the top of the support system so your belly goes flat, but your upper back is rotated. Then I'm going to take this. That's going to help to support your head. So there we go. We're using the two pieces of that. This arm can go forward. Now, any discomfort? What we want to be careful for in these rotated positions is while one segment is definitely going to be on the stretch, it's important to note that there's also going to be another segment squashed on the short. So we don't want to be in these positions too long. Is the underneath right chest okay?
Yes.
Any discomfort in the right chest or neck?
No.
Make sure you leave those pec muscles in the front of the shoulder nice and loose.
Okay.
We certainly don't want the pec or the coracobrachialis to contract on the short. That would cause a shortening activation. So we're going to look for the spinous process here in this mid upper to mid back. We're going to find the spinous processes here. We're going to come just lateral and we're going to find the lamina groove. I'm going to take myself a nice long lunge. I'm going to use the olecranon process of my elbow, but I'm also going to keep my other hand here to make sure that I don't snap or fall off the segment that I'm looking to treat. And again, our clinical reasoning has informed the reason why we're here is because my client drew his pain picture showing me that he had pain right in the middle here, which also may be associated with the rhomboids, and we're certainly going to be getting a piece of each while we treat through the rhomboids to get to the multifidi. I'm going to be pressing straight down, then I may press up and in. Give me a number of discomfort I'm causing you.
3 to 4.
3 to 4. Big breath in from the tummy. Nice exhale out. Let everything be loose. The underneath arm is still okay?
Yes.
Great. I'm going to back off while he breathes in. Make sure I'm still where I want to be. Press in. This is my second attempt. Give it a number.
3.
3. I'm pressing about the same amount per square inch. I backed away and I'm going to repeat again. And again, to give you 2 cents here, if I rotated my arm and you could see, I'm not using my lats or my teres. I'm simply using my standing lunge to press me forward into the humerus. No pulling down or no use of my lats. Now I'm going to move to the next segment. Again, I'm staying really relaxed. I've got a nice long lunge. Give me a number here.
Back to 3, 4.
To 3, 4.
Yeah.
Any spreading out or shadowing of discomfort?
No, right on the spot.
Right on the spot. Again, classic of the multifidi, backing off, breathing in, and we're going to repeat. So we would be repeating that in as many segments as we could. And very interesting, I am getting a little bit of myofascial pitting here. I would then switch the entire table around and go to the other side and treat the same segments all the way through. And then we would follow the rehabilitation. You can come out of that position back to your knees. We'd follow the same rehabilitation protocol as we would every day and finish this with rotational stretching, flexion and extension of the spine, flexion and extension of the spine. And then I would be teaching Ted here how to go home and do self-care on his own. We're going to include that video, which will be including the use of the back knobber, specifically for the multifidi and or for the longissimus thoracis or any of the longissimus segments in another link after this video. So if you'd like more information about advanced techniques for trigger point therapy, go to the link below this video or go to our website, Chicago Center for Myofascial Pain Relief, and you can click on training seminars.